We also talked about experts and the media, and now we come closer to our keynote for today. So experts often talk to the media in order to enhance their reputation, and at the same time, maybe they shouldn't talk too much to the media as experts, as they are involved in crisis as experts. So what we are now about to do today, I think I skipped the housekeeping notes for today. It's the issue of learning in and from crisis. So what can be learned from crisis? What will outlast once the crisis is over? What are the trajectories of learning in, for, and from crisis? And how can we generalize from rare and exceptional situations? So this is the kind of the agenda for this afternoon and for the concluding session. And now I'm happy to introduce Shari Veal to you. Shari is a professor and dean of the College of Journalism and Mass Communication at the University of Nebraska-Lincoln in the US. And she oversees the strategic, programmatic, financial, fundraising, and management operations of this college in her function as dean. Dr. Veal previously served as an associate dean and director of the Risk Science Division in the College of Communication and Information at the University of Kentucky. And at the same time also as the director of the Center for Risk and Crisis Management. Not at the same time, before that she was director of the Center for Risk and Crisis Management at the University of Oklahoma. Her research on organizational learning in high-risk environments, community preparedness, communication strategies for crisis management has been funded by the National Science Foundation and the United States Departments of Agriculture, Environmental Protection Agency, Department of Homeland Security. Shari has published widely on issues of risk and crisis communication, crisis renewal, corporate crisis, value chain related crisis, crisis spillovers, and cybersecurity crisis. And I mentioned only a few journals. Among them are the journal Crisis Communication, Journal of Public Relations Research, Corporate Reputation Review, and I'll stop it here. There are many more, of course. And Shari is not only an outstanding researcher, she is also involved in consultancy and in training organizational members in crisis prevention and crisis communication. So she combines really academic knowledge and practical knowledge. And we are really curious to hear your talk. Shari, welcome.
Thank you very much, Oliver. I'm glad to be here. I wish I were in person, but I'm glad to join virtually. Today, really, I'm going to break this down into two separate areas. First, we're going to talk a little bit about organizational learning in crisis, and then I'm going to give an example of research that we've done with the Environmental Protection Agency where we did a crisis assessment, but then in order to learn from what happened in those crises, but then to put them together as best practices, which we now use for crisis preparedness and planning for other organizations. So organizational learning in crisis. Crisis really motivates learning. They're critical events and they can really create these transformational learning opportunities. Especially when there's a critical failure that occurs, you're more likely to learn from that because you recognize that there's an issue there. They have those dramatic features that demand attention and force us to reframe our understanding of the situation, which is going to increase our potential for learning. Sitkin would suggest that failure is an essential prerequisite for effective organizational learning and adaptation. And while I agree that crisis definitely motivates learning, I think there are several opportunities to learn from in the process of preparing to protect the organization from crisis. And that's really what we're trying to move to, is that you're learning from small failures, you're learning from warning signals, you're learning from the process of preparing for a crisis that actually allows you to prevent a crisis or at least respond more quickly when a crisis does occur. So we found that organizations that treat crisis as a learning opportunity tend to recover more quickly because they already have the strategies in place, suffer damage, they're able to capitalize more fully on the opportunities created, and they can actually bolster their legitimacy and organizational reputation post-crisis if they demonstrate that they have learned from the crisis and really set a new standard for the rest of the industry. Now, When we look at organizational learning, there's different ways of learning, different levels of learning. These loops of learning can start with that single loop, so where you make small improvements just to correct the underlying policies or considering organizational, without considering the underlying policies and organizational values. Second is double loop learning, where corrective action is taken, information is reframed, policies are changed. Triple loop learning considers the organizational culture in which the policies are created, and that actually leads to transformation of the organization. So if you think of a company that processes, right, they go through, they're putting out 2x4s, continually them out to be able to sell them. And they're finding that they have a number of accidents along the line. So employees who are losing fingers, losing hands, several issues with the wood running through the saw. They come in, they find out that the employees have removed the shields that are protecting the saw and protecting individuals from cutting themselves. And they've removed the shield. So they decide they're going to fix it. They put the shield back on and they bolt it in place so that no one can remove it. Well, now you have, a few weeks later, you find that production is down, employees are being fired. They're losing work staff, people are quitting, so now they're low on staff. And ultimately what they find when they do the research behind it was that there was a manager that pushed on, you have to get it done, you have to meet your quota. If you don't meet your quota, you're going to be fired. Adding that culture of pressure to get the wood out, to get the product moving. Well, it moves faster when you take the shield off. So in order to keep their job, they would take the shield off in order to move it through. It wasn't because they wanted to hurt themselves. It was because they felt this pressure from that culture, and that's why they made that change. So if you think of these different levels of something small, while we have all these employee incidents, how big that can be when you figure out the actual culture behind it that led to that in the first place. So different levels of learning in a small example. So there's also failures that can occur when you're trying to learn. So first, scanning failure, failure to notice those warning signals, often due to arrogance or lack of resources or inattention, just not recognizing that there's issues out there. Failure to understand how complicated information can fit together, so integration failure. If you followed any of Perot's work, looking at small failures, looking at integration of technology, that would fit in that line. Incentive failure, a failure to provide rewards to people who report problems. So in some of the original work that I did on organizational learning, we looked at Chernobyl and just the mum effect that was created because you couldn't talk about issues, you couldn't talk about problems without getting in trouble. So essentially, if you let them know about an issue, you would be punished rather than rewarded for addressing the issue early and making sure that it goes up the chain. Learning failure, failure to learn from crises and preserve memories in the organization. We all think of BP oil crisis as the big explosion in the Gulf. They had dealt with multiple crises before that. Texas City in particular had multiple incidents where they could have learned from those processes in order to prevent future crises. Failure of success, I'll talk about a little bit more here, but it's reliance on past success that prevents recognition of future failure. Like I said, I'll break that one down a bit here. And then unlearning failure, failure to change strategies that led to the crisis in the first place. So unlearning failure is really not getting to that triple loop learning. So failure of success. Sitkin talks about success misleading organizations into thinking change isn't needed. It fosters decreased search and attention, increased complacency, risk aversion, and really that you don't adapt. You just keep staying the course. And if you've read any of Tompkins' work on Challenger, even on Columbia from that standpoint, that's really what we saw in NASA, this idea that we cannot fail. In fact, NASA's logo, I have a great lanyard that I picked up in Houston one time. It says, failure is not an option. Well, they were so focused on success that they didn't stop launches that should have been stopped because of a potential failure. One of my favorite quotes in looking at risk and crisis communication research is Wick and Sutcliffe's, "Arrogance and hubris breed vulnerability." Ties in well with the failure of success. So ultimately, organizational learning is a process of detecting and correcting errors. But those errors have to be shared and analyzed to actually enact change. If you aren't sharing the errors with other departments, other divisions in the organization, you're not going to be able to learn holistically as part of that organization. And change must be demonstrated to stakeholders to maintain legitimacy. So post-crisis, how are you enacting change, and how are you letting your stakeholders know what you've changed in order to prevent the next potential crisis? Really, when we look at mindfulness, there's kind of a different split between mindlessness and mindfulness. So this is how you are looking at the situation. Mindlessness is focusing on the goal, not the process to reach the goal. You're acting from a single perspective, responding automatically to categories. Trained mindlessness is that we just follow, this is the way things have always been done around here, therefore this is how we're going to do them now. Mindfulness focuses on the process, not the preconceived notion of what the outcome should be. You're aware of multiple perspectives. You invite multiple perspectives into that conversation. You're open to new information. Create new categories for that information. So we often look at, if you recall, the Virginia Tech shooting, in which police were delayed for a long time looking across campus because they made the assumption that it was a domestic issue. They were trying to track down the boyfriend from the first victim of the shooting. They were looking mindlessly at this is the way things typically go, and they weren't considering those other reports that were coming in that might be related. So there's certain conditions for mindful learning. Conflict between goals, undesirable consequences of a strategy you must enact, slow interpretation of situations, and unique situations. And all of those align with crisis, which makes crisis the ideal time to be focusing on mindful learning. Mindful learning creates an awareness that filters through the routines and draws attention to what does not match our expectations. We're reframing the situation with all new information coming in so that we can view elements of the process and correct any that may be out of place. You think of what occurred with COVID-19, particularly in the US, there was a long time where we were beating the drum of masks don't do anything. Well, we weren't open to that other information. We weren't willing to accept the word of Chinese researchers who had been studying masks for a long time in these different areas. So again, reframing the information and considering other perspectives can help us better learn in a crisis. And then recognizing small failures or even subtle deviations from the norm allows organizations to prevent crises and limit the severity of crises that do occur. So recognizing when something's out of place, noticing that the shield has been taken off the saw and addressing it there to find out deeply what is occurring and why it was removed in the first place rather than just bolting it back on. So I want to talk a little bit now about how we get to that point. So if we consider knowledge management, this process of collecting information from all different areas. So it might be complaints that are coming in. It might be other organizations that are going through crises, right? You're doing that boundary spanning. All of those different pieces coming together. But then once you have that, you have to share it out. So the crisis management team shouldn't just be in the response to the crisis. They should also be the issue management team that is looking at what could be happening out there, watching for those warning signals, watching for those subtle deviations. Then interpreting that information that comes in. What does it mean? How does it affect one department compared to another? And then ultimately storing that knowledge as well. Now we acquire knowledge through different ways. There's a knowledge that is with us at the beginning of the organization, right? Why it was created, what was the original mission, the values of the organization. There's experiential, intentional or unintentional, where we are learning from what we are doing in the organization, what we are doing day to day, learning from failure, learning from crisis, learning from day-to-day interactions. There's vicarious learning, as I mentioned, where you're looking at other organizations, observing, modeling behavior after others. I do a lot of research in the area of spillover effects. So when a crisis occurs in one organization, how does that affect the next organization in line? So whether it's down the supply chain or whether it's a similar organization in the same industry. And if one organization in the same industry is going through a type of crisis, chances are that you are at risk for that same type of crisis. And then lastly, grafting, acquisition of new members with new knowledge. And this is something we see with mergers often, where you merge the two companies, but you actually only keep employees from one company, or you only keep a handful of employees from the other company. Or if you do merge them together, then one vision typically moves forward. And those who come in with different knowledge, different perspectives, are told to be quiet because that's not the way we do things around here. So really taking that opportunity where anytime you bring a new member, anytime you add a member to the crisis management team, you should be trying to learn from that individual because they have a different perspective. They haven't already created those blinders with, this is how we respond to crises here. So there are also some management flaws that come in, and we can see some different examples of this in crises. Serial reproduction errors. The Sago mine disaster would be a good example of that. If you remember that situation, number of miners were trapped underground. Word came back that they found them, they were alive, and in fact, what the case is that no, they did not survive, but it had already been reported through the media because it was passed from one person to the next with the lack of interpretation of what was actually happening. I already mentioned the mum effect that blocks that flow of negative information. Message overload. We saw this with the Fukushima, too much information blocking the processing of information. We had the earthquake, we had the tsunami, then we had the nuclear explosion, all of this stuff coming in at one time, and it was difficult to really process what was happening in order to respond. Information acquisition bias, focusing on, certain information and disregarding the rest. I mentioned that with Virginia Tech, focusing on the domestic issue versus the campus-wide issue. And then group decision-making errors, failure to see problems and failure to evaluate alternatives. Again, that's that example of BP where recognizing that the culture was really what was leading to those multiple incidents over and over, where we were focusing on cutting costs versus putting people first. Knowledge management flaws can also come in the order of turnover loss. So particularly in the US, if an organization is going through a crisis, we figure out who our scapegoat is going to be. Typically it's the CEO, whoever is the head of the department. They are to blame. We remove them. Now everything is better. Well, if we remove the team that went through that crisis, we remove the people who are most likely to learn from that crisis and then enact that learning throughout the organization. It's also a failure to anticipate needs and causes for information loss. So when you think of bringing all that information together to understand what's happening in the crisis management team, how do you anticipate how a complaint in one area could actually affect something else farther down the line? Stored information may not always be useful. You're hanging on to information that is really just redundant or could be distracting. And employees may not know stored information exists. So if you think of HR issues that you have, when a complaint comes in about one individual who's creating a hostile work environment, are you keeping those reports? Does the next manager coming in know where those reports are located? Do they know about those previous complaints? It's one thing to have one complaint. It's another to have 5 years of 2 to 3 complaints every year where then you show a pattern of hostile behavior. So now I'm going to flip over a little bit and talk about learning through best practices. So give an actual example of how this can be done and how we're using it now after we've done different assessments. So when you look at best practices, they're typically developed through practice-driven grounded theory, right? It's based on something you've done, what works well, and that's the best practice that you set up for the next time around. It can also be developed through systematic research, which is we're going to talk about an extension of the best practices that really came from systematic research. They're particularly useful in developing generalized standards and principles, especially as an area of practice is still maturing and developing. Crisis communication hasn't been around all that long when you make a comparison to psychology and organizational behavior. I mean, this is still coming along. We're still learning how to respond to crises. The analysis of work-related knowledge helps identify crisis-producing fallacies and crisis-avoiding adaptive processes. So how are we adapting to avoid a crisis without actually learning from the situation? How are we analyzing that? And one little word of caution here, though, widespread adoption of best practices should always be undertaken cautiously with an understanding of the contextual factors. So just because the best practices work in one area doesn't mean that you can automatically apply them to another. They have to be tested. You have to figure out what does and doesn't fit. So the original best practices came out of a study originally from the U.S. Department of Agriculture, then was added in after 9/11 when we developed the Department of Homeland Security Centers of Excellence. This original model was published in 2006, I believe, in the Journal of Applied Communications Research. Matt Seeger was the original author on this. My role in it was I was the graduate student sitting in the lobby of the hotel during the National Communication Association conference designing this model. I was a graduate student at the time, working with the team of bringing in all different experts in risk and crisis communication. So we brought together Heath and Ropeik and Sandman and Covello and a series of other scholars in the area of risk and crisis communication to talk about best practices. So from their experience consulting, teaching, doing research in this area, what are those best practices? And that's where we came to this original list of best practices. And I'll get through these when we get to the end talking about guidelines. So what we did with these best practices in order to figure out how it applies beyond that original consideration from the experts. So this is what the experts said. So now we have to take these best practices and actually apply them, see how they work. Do they stand up in practice? So for this case, we took 5 distinct environmental crises. Funding was from the environmental protection agencies in order to better understand how organizations, government agencies respond to crises. We organized the evidence from each of the cases according to the underlying construct of the best practice. We used case evidence to identify examples that demonstrated whether or not the organization or the government agency adhered to the best practices or they did not. Each of those cases resulted in lessons learned, but then we took the evidence from the case that didn't fit into those best practices and looked what were those communication challenges that existed across those cases but weren't included in the best practices. We then compared those challenges, we consolidated them and categorized them and put them within that best practice framework to create guidelines. So I'm going to breeze through these cases very quickly, just a quick little sum of them, and then not even going to get too in-depth into each of the pros and cons, what went well, what didn't go well. If you want information, I'm happy to send you information on all of these. Each of these cases had separate papers that were written on them, plus the overarching chapter that pulled everything together. So the first case we looked at was the Canadian Pacific Railway derailment. This was a case of a train derailed in Minot, North Dakota, releasing anhydrous ammonia. And the biggest challenge in this situation, this is January of 2002, so right January after 9/11, and Minot, North Dakota, location of the largest air base and protects where we have our nuclear warheads in the U.S. So it is considered a very high military area. A lot of concern that was coming in where you have now this noxious cloud that is literally sucking the moisture out of your body, burning your eyes, burning your throat, that the community was dealing with. So we interviewed on-site coordinators, interviewed individuals who were part of the communication process because this was ultimately a communication failure. So in Minot, there's only a number of lines that come in. When you call 911, they didn't have lines to be able to call dispatch, so people would literally call 911 and get hung up on while the dispatchers were trying to get a line to call out for emergency services. Everything was piped in by satellite, so you would turn on the radio and you'd be hearing music in the middle of choking in your home. So we looked at this case, we looked at the strengths of the response, what they had in place, what they didn't have in place, failing to acknowledge uncertainty, lack of compassionate communication. They didn't evaluate and update their plan. It was an outdated plan. They weren't accounting for cultural differences. Where this occurred was in the middle of a high Spanish-speaking community, and what media they listened to, there was no focus on what they were doing as a community. The post-Katrina travel trailers, this is probably one of the most fascinating cases I ever worked on. After Hurricane Katrina, a number of individuals were displaced into these trailers. They started complaining about sore throats, sinus issues. They ultimately attracted to the formaldehyde in the wood in the trailers. And we interviewed the former director of FEMA, the deputy director. Remember, all of this was happening right after Hurricane Katrina that had such a bungled response from FEMA that a number of people, they did a bad job, therefore we removed them. So these are all new staffers. They were at half the staff they were before Katrina. They were scrambling to figure out what's going on and try to organize things. And they had no idea how to determine the level of formaldehyde. We were talking yesterday about being an expert in one area and why you shouldn't step out of your zone as to where you are an expert. FEMA had such a poor reputation by that point that they couldn't get other government agencies to work with them. So trying to get the CDC to work, trying to get the Environmental Protection Agency to work with them was very challenging. And when I talked to Director Paulson, his comment was, I understand. They didn't want to be tainted by our crisis. So how do you build those relationships? Ultimately, we referred to it as the pariah effect. So where your reputation is so tarnished post-crisis that people don't want to touch you. They don't want that spillover effect of being associated with you as an organization in crisis. So FEMA had to ultimately set the standard for what is allowable levels of formaldehyde. FEMA would never be setting the standard for formaldehyde in travel trailers if it weren't for this crisis, but no one else would, and they had to move forward. So we go through the strengths and weaknesses of that organization as well. No system for residents to voice their concerns with the agency, no upward communication. They really struggled in communicating compassion. They did eventually provide instruction for self-efficacy, but the messages were too late and illness was already widespread in those areas, and people are still suffering from respiratory issues from that experience. Real quick, a couple of these other ones, the Creek Superfund site, these were mining tins that were left behind all around a community. They found 35% of children had elevated blood lead levels, which is going to lead to mental development issues for those children. How they responded was very slow in dealing with the situation, and then in the midst of all of that, an F4 tornado hit the area and spread all of that toxic soil around the community. There we are working with the head of an organization that was tracking these children in order to see how they are developing. We are working with local media as part of that, working with the EPA and how they responded and how they engaged as well. Some of the things that we found there, especially when you're looking at dealing with children, that's going to change how you understand the situation. So the fact that this crisis was affecting children and affecting their future potential is really what elevated the crisis more than anything else. So that was something that drew out as we set that aside. We focused just on the best practices to start, what they did well, what they didn't do well. The Tennessee Valley Authority's coal ash spill, it's a case where a dam broke, the coal ash flowed into the river, moved homes, releasing 5.4 million yards of coal ash sludge into the Emory River. We went through, interviewed individuals there, same thing, general manager. In all of these cases, we tried to interview people who were directly involved in responding to the crisis. We looked at the media coverage of it. We looked at any kind of testimony that was part of the crisis, and really looking at it after, how everything was dealt with during the crisis. Again, strengths and weaknesses of those individual organizations and their response. BP oil spill, mentioned a couple times, that was another case that we went through where we were focusing on how did they respond, what did they do well, what did they not do well. A lot of research behind that, a lot of reports that came in, because there was also went through Congress here as well. And these were cases where, looking at your actual plan that you have in place, the plan that they had in place for response to an oil spill, they had one. They had one on file with mining and minerals. However, the plan was for if there was a spill up in Alaska. Different water, different temperature, different animals, different wind patterns, changes everything in how the oil is going to dispense within that area. So just issues that came up and how they were responding because they were planning for a different type of crisis in a different area. So after we went through and did an assessment of each of those different crises, looking at what they did well, what they didn't do well, learning from those crises, we then went back and looked at those communication challenges that didn't fit. So then we recognized that safety and well-being of affected individuals should be a primary concern. That should be a no-brainer, right? We should always be focusing on the safety and well-being of the individuals affected. And yet we don't always do that. So how can we better understand the situation in order to be able to support those organizations that are trying to protect the public? How do we partner with them to make sure that we are doing that? Post-Katrina travel trailers, we have to make sure that we are evaluating our crisis response plans for potential risks. So if you look at the crisis response plans for trailers at the time, they were worried about mold. They were worried about water. They never considered, and why would they, that there would be a toxic fume inside the trailer that would be affecting individuals. We also found that poor previous crisis response compounds negative media coverage. FEMA was already way behind when they started with the trailers because of what had happened with Katrina. I'm just skipping through some of these just to demonstrate where we were getting these best practices from. TVA coal ash spill, similar to BP, they were their response plan was based on a nuclear power plant, not on their coal plant. So very, very different technology, very different risks, but they didn't update their plan for the individual situation. Mentioned earlier, Tar Creek Superfund, how it had affected children differently. BP oil spill, looking at media accessibility, and that is determined by the media, not by the organization. Organization claimed they were doing a great job when, in fact, the media would come back and actually report on how BP was reacting to the media. So we took those best practices and then we looked at how we can learn as crisis communication scholars from these different situations to better update our planning, our preparedness working with future organizations. So if you see these different stars on there, those are additional best practices or changes to the best practices we integrated. So adding that prioritizing the safety and well-being of the public, acknowledging and accounting for vulnerable populations is different than acknowledging and accounting for cultural differences. A vulnerable population may be individuals who don't have a cell phone, depending on the crisis that you're dealing with. Forming partnerships with the public, we actually separated that out from establishing a crisis communication network because they're very different things. That crisis communication network is recognizing who are your partners in the response. So you think of FEMA needing to respond to a health crisis, normally it would be the CDC. In this case, they were dealing with a toxic chemical. So then you bring in Environmental Protection Agency, then you start bringing in experts in a whole different area that has nothing to do with what you would normally do in an emergency response situation. Forming partnerships with the public, make sure that you're listening to them, that you're providing for upward communication needed to be added into this as well. Accepting uncertainty, and we added a avoiding public speculation. This was an issue with both BP as well as with TVA, where they were making assumptions as to the amount of environmental threat that was occurring, and their assumptions were way off. In fact, BP was way under, TVA was actually way over, but they were speculating because they felt pressured by the media to give an answer when they didn't know the answer. And they started speculating, which made them look like they were lying when it came back through. Not just providing for self-efficacy, but also providing instruction for self-protection. So in each case where the public is at risk, how are you instructing them on how to protect themselves? And is that part of your plan now? Tailoring messages to those affected audiences. And then that last one that we added in, complete and communicate recovery efforts. If the last thing in the media was that the crisis occurred, if something else happens, that's what they're going to go back to. So actually reporting back to the media what was fixed in the crisis, what is different now in the organization because of that crisis. So again, demonstrating learning that also gives you the opportunity to bolster reputation. And for some communicators, that feels counterintuitive. Oh, they're not talking about us anymore in the media. Let's just leave it alone. Well, you actually want to be in the media in that case to demonstrate what you have done to address the issue. So now what we are working on, we take these essential guidelines for ongoing risk and crisis communication, and rather than doing it as a post-crisis analysis, which we will still, I'm sure, do just to look at what happened in different situations. And typically when we get called in, it's because of a crisis, because the crisis already happened. And now, okay, we really have to figure out what went wrong here in order to learn. We use these guidelines to go through, look at what they did well, look at what they did not do well, and then we start making a plan based on these. So if you look at strategic planning, planning ahead for a prompt response, is there a crisis communication plan in place? Is it clear? Is it actually specific enough that you can address the situation? Establishing that crisis communication network, you go through all of the different risks your organization could be exposed to. Who are the partners you would need to involve? Do you know who they are? Are you meeting with them beforehand so that you know how you would respond in a certain situation? And some of it is easy. I mean, if you run a restaurant, you have a pretty good idea that you're going to have to deal with public health at some time. You're going to have to deal with Food and Drug Administration if you're dealing with another issue. So think of who those partners are, at least know who you can call and have a conversation beforehand so that you start to build that network. I mentioned prioritize the safety and well-being of the public. Looking at your crisis plan, is that the priority? Do you talk about it? Do you remind everyone on the crisis team that that has to be a priority? It's not just about protecting the reputation, because if you don't protect the public, you're not going to have that reputation to protect later. Inclusive approach, we advocate for listening to public concerns, again, tracking that information, collecting information, acknowledging both vulnerable populations and cultural differences, forming partnerships with the public, meeting the needs of the media, and remaining accessible. So we've gone into organizations where if there's a crisis in the media calls, they just let it go to voicemail so they can think about what they're going to say and process it later. It's not meeting the needs of the media. That is letting someone else tell the story of the crisis while you're thinking about how you're going to respond. So you have to have that plan in place in order to respond when it occurs. Accepting uncertainty and avoiding public speculation, as I mentioned, providing instruction for self-protection, tailoring messages to the affected audiences, communicating with honesty, candor, and openness. How are we doing that? As we look at our crisis plan, how are we making sure that we are honest? Are we making that a priority with being open with the public with what's happening? This is what we know. This is what we don't know. This is what we're doing to find out what we don't know. Communicating with compassion, concern, and empathy. And then those last two of corrective action that I mentioned, where you complete and communicate recovery efforts, and then continuously evaluate and update your crisis plans. So today we talked about how crises create transformational learning opportunities. And we know that organizations that prioritize learning, they can capitalize more fully on the opportunities that are created in that process. Mindful learning focuses on the process an underlying culture that created the process that allowed for the crisis to occur. It's not focused on finding the answer to the crisis. And then ultimately, best practices assessment can be used as a learning tool to help organizations learn before, during, and after the crisis. So you can use it as you're doing an assessment of a crisis that's already occurred, in working with an organization as they're developing their crisis response plan. What are we doing? How are we responding? How does this fit within our larger plan? And are we meeting all of these best practices? And then ultimately for scholars, as we look at these guidelines, this particular case was within environmental crises. How does this stand up to health crises, to educational crises, to financial crises? Do these still stand up in that manner? And figuring out what does and doesn't fit in order to advance our understanding of best practices moving forward. Thank you.